on a SOAP note, an SOAP note, SOAP note. It's a charting technique we're going to use for exams. I guess specifically we're going to use it for limited exams when patients come in for a specific problem. Okay, we probably won't use it for periodics, and we're probably not going to use it for a comprehensive exam unless, of course, the patient's coming in with a specific problem. This has been something that's used both in medical and dental fields, and so we're going to take how it is going to be applied really to dentistry in our office in particular. So first of all, let's go over, well, what does SOAP stand for? It's an acronym. S is subjective. It's really what the patient says. Okay, that's what we're going to take down. It's everything that they told us on the phone, they told us while they're sitting in the chair. They may even tell us this during the actual exam itself. It's kind of reporting their experience or what has led to the problem that they're having in their own words. That's what we're going to be putting into the chart. O is going to be objective. It's what we observe. It's what we are testing. It's all the things that we're going to be making notes of during the exam so that we can then come to the letter A, which is assessment. So if you take the subjective and you add the objective, you take those two, put them together, you're going to get the assessment, which is also our diagnosis. And it could be more than one diagnosis, actually. I'll get into more details of that here in a second. P stands for plan, or what was recommended to do or what was actually done during the appointment. So let's go through that. S, subjective. It's what's the patient's description of the problem. We're going to use, like I said, their own words, okay? Because how they describe something, we need to be able to put that directly into the chart. We don't want to start trying to interpret what they're saying. We want to say what they said and put that in the chart. Okay, it's what, we want to put in anything that the patient says. What makes the problem worse? What makes it better? What medications have they taken? What's the history of the problem? What led to it? What's been kind of the pattern of their pain over time? It's just kind of all the descriptive things that the patient is reporting to us on what they're experiencing. I'm going to go back for a second. When we're putting this in there, there's no need to say patient says ... Okay, it's just go ahead and put what they say. We're just going to assume that if it's in the subjective part, it's what the patient has told us. Okay. Objective. It's kind of the data that the doctor is gathering. Okay. It's the visual appearance of what they're seeing. It's the tests that were performed and the results from those tests. Any radiographs that we're taking, and what did we observe or what were the notes on those radiographs. Also, I'll put down the patient's blood pressure and pulse. That's what we're going to put down on every chart, but this would be the place to put in their blood pressure and pulse because it is an observable, measurable test that we are administering in the office. Objective. Further, some more stuff on that. If we test something and if that particular test is within normal limits, we don't just say within normal limits or WNL. We're going to go ahead and explain what the test was, what test we or what teeth we tested, and then we can say what it was. For example, if we did endo-ice on teeth numbers 12 through 15, it produced a positive non-lingering response, which that's kind of a healthy tooth response, that was similar on all the teeth, then we would say that appears within normal limits. We would not just say cold test dash WNL. Okay, we have to say what we tested that was within normal limits. It's a little bit more descriptive than just saying WNL. Assessment. It's the primary diagnosis plus any other possible diagnoses. This is the subjective, and I'll say this, that the objective and the subjective, when you put those together, it has to support the assessment. Okay, if you have a diagnosis, then there has to be a reason why or how we came up with that diagnosis, and it's the things reported previously, the subjective and the objective, that will support that diagnosis and hence the upcoming treatment plan. Another note, just like what I said earlier about what the patient says, we're not going to put in doctor said blah blah blah. We're also going to say doctor tested teeth numbers 40. Just assume that the doctor did this work. Okay, you don't have to say that the doctor said or did something. Just say what the results were of those tests. And then P is the plan or the treatment plan, plus any other options given to the patient. And then we want to put down what the patient chose of those options. And if the patient starts same-day treatment, then we're going to begin our usual notes after this SOAP note. So the SOAP note's really just kind of the exam itself that then leads to why we're going to be doing the treatment we're going to do. Okay, so let's go through a couple of examples real quick. I'm going to give you 3 examples. They're all going to be similar in that they're going to involve, you'll see here, tooth number 12. So let's say here, the patient reports pain on the upper left premolar area after biting into an almond yesterday. When biting down, it hurts. Did not get much sleep last night due to pain. Took 2 Advil last night and 2 this morning. Our objective findings. Number 12 has a large MOD amalgam. Palatable cusp is tender to touch and bite stick positive. Gum tissue is pink and probing is 3 millimeters or less. There's no mobility. And cold test on 12 through 14 with number 12 having lingering pain. Bite wing and PA taken, no decay, bone support is good, no apical involvement around any teeth. The assessment, number 12, cracked tooth with irreversible pulpitis. Plan, option 1, buildup in crown. While wearing a temp, if pain does not subside, refer to endo to evaluate extent of crack. May result in root canal or extraction. Option 2, extraction or extract the tooth. And then patient chose option 1. And then after that, we'd go ahead and record the actual treatment that we did for the day. Okay, example number 2. Reports pain on upper left premolar area. The area has been achy for the past few weeks, but got much worse last night. Patient took 2 Advil last night and 2 Advil this morning. Pain level before taking Advil was an 8. Number 12, MOD amalgam. 13, occlusal composite. 14, crown. Percussion test, 12 through 15, 12, sensitive. Cold test, cold test, 12 through 15, 12, no response. 13 through 15, positive, non-lingering. Bite stick test, 12 through 15, number 12, tender. Bite wing and PA taken, radiolucency at the apex of 12, and mesial of number 13. The assessment, number 12, necrotic pulp with apical involvement, or some doctors will say with apical periodontitis. Either way, it's fine. Number 13, mesial decay. Plan, number 12, root canal buildup in crown. 13, MO composite. Patient also given option to extract number 12. Patient chose root canal and crown for 12, but to wait to treat number 13. Okay, so you can see both of these cases, tooth number 12 was the culprit, but had different diagnoses and hence different plans. All right, last example. We're not going to say patient reports, we're just going to say reports. Reports pain on upper left premolar area. Had crown prep 1 week ago here and is wearing a temp crown. It hurts to chew and wakes patient up at night. Chart entry from prep appointment states diagnosis for 12 was failed MOD with recurrent decay. Prep photo shows no crack. PA taken today showed no change from prep date, no pathology at apex. Marking paper shows heavy occlusal contact on number 12 temp. The assessment, traumatic occlusion on temp crown. The plan, reduce occlusion on temp. If pain does not resolve in the next 7 to 10 days, a return for evaluation and possible endo. Let me fix that slide. Okay, if pain does not resolve in the next 7 to 10 days, return to office for further evaluation, possible endo. So you can see in these 3 examples, all of them involve tooth number 12, but they had different diagnoses and different treatments that were performed for that tooth, all patient reported with pain. So you can see when we work through this in a logical sequence, the S, O, A, and P, we come up with something that's easily understandable. It's a good template or a good way to systematize our chart writings so that anybody reading this, whether it be another doctor, whether it be an insurance company, a state board, some other specialist that they need information from, patient moves and requests to records, all of this stuff stands up and makes complete sense. So we're going to start incorporating SOAP notes on our limited exams, and we'll work through some of the details as these unique cases come through, but this kind of gives you a basic understanding of how that works. All right, great, thanks.